You all. My name is Maya, if you do not know. So I just wanted to get on here and talk to you about my breast cancer diagnosis. And I hope that I can help someone who's going through the same thing. Or I hope that if you're feeling a lump or feeling anything of some sort and it doesn't feel right, that this story will make you go and look into it. So I'm 30 years old. I just turned 30 in November, and I found out January 4th, 2022 that I have breast cancer. I found out because at the top of January 2021, I felt a lump on the side of my breast, and I went to my gynecologist and she referred me out to DCA, which is Diagnostic Centers of America. When I got there, they did an ultrasound on me and they concluded that I just had lumpy breast tissue, and they just told me to come back in 6 months. So I went back in 6 months for a follow-up, and when I went back, the ultrasound tech did my ultrasound, but this particular time the ultrasound tech that I had was asking way more questions than the first ultrasound tech did. And they were both DCA, but they were in two different locations. The first one I went to was in West Palm, and the second one was in Palm Beach Gardens. So when I went to the one in Palm Beach Gardens, she asked a lot of questions. She asked me how long had I been feeling it. I told her what the first ultrasound tech told me, which was it was just lumpy breast tissue, but she didn't seem convinced that it was just lumpy breast tissue. So she did more of an in-depth look during her ultrasound than the first ultrasound tech did. And then she just told me to wait in the waiting room while she sends the results over to the radiologist. The radiologist then came back and said that I needed to do a mammogram. Just a reminder, mammograms are not done on anyone unless they're 40 years old, and I'm only 30. So with that being said, at that point it became concerning. I got a little nervous. I was concerned. I didn't know what to think. I knew something was wrong. I honestly did. I knew something was wrong, but I just didn't think that it would be cancer. I thought maybe a little cyst or something of that nature. But I was wrong. I did the mammogram. And when I did the mammogram, and the report came back, it came back that it was a BI-RAD5. So I didn't know what a BI-RAD5 was. So when I got home, I just started doing a bunch of research. I was just Google. I was Googling so much my eyes felt like they were about to fall out of my head. And I found out that meant it was highly suspicious and most likely cancer. So when I saw that, my mind instantly went to the worst, and I didn't know what to think. So DCA told me that I needed to go do a biopsy. I didn't know what a biopsy was. Never had one. Never really had heard anyone talking about it, so I really didn't know what it was. So I went in to do my biopsy, and let me just tell y'all, the radiologist that I had, Dr. Goodwin, he was awesome. His nurses, everyone there was awesome. Their attitudes were great. And it's something about being somewhere with people with friendly attitudes and nurses that make you feel so much more comfortable about a negative situation, right? So they were just there talking to me, telling me everything would be fine. They were going to figure it out. They were going to see what was wrong. So I did the biopsy, and I had to wait. They told me it would take about 3 to 5 days. I waited, and when I tell you, those were the longest 3 days of my life. I didn't know what to think. I cried. I was overthinking. I was on Google. That's another thing. Please don't get on Google. Google will drive you crazy because there's so many fake doctors on Google that everybody think they know what they're talking about, and it will drive you insane because it drove me crazy. I was on Google every single day. Every day. It got to a point where my husband would call me just to make sure I wasn't on Google. It was bad. So After that, the biopsy came back, and when it came back, he said that it was malignant. He said that it was two different types in the one breast. It was infiltrating ductal carcinoma and ductal carcinoma. Ductal carcinoma is the type of cancer that it's just, now don't quote me because I'm not a doctor, I'm just going based off what I've seen and what I've heard. Ductal carcinoma is a type of cancer that is strictly stuck to your milk ducts in your breast. So it cannot spread. It's only in your milk ducts. The second one, which is infiltrating ductal carcinoma, that one is an invasive type of cancer, but mine is very, very, very small. It's really little, and it's inside of the DCIS. The mass that I have, I think she said it was about 8 millimeters, and the ductal carcinoma was about 11 centimeters. So the ductal carcinoma pretty much covered the whole left side of my breast. Now, when he told me that, I didn't really hear that, to be honest with you. All I heard was cancer. He didn't even say cancer, but I heard cancer in my head. That's all I heard was cancer. So when he was explaining it to me, I don't know what he said. I could honestly tell you, I don't know what he said. When we hung up, he said, if you have any questions, you can call me. We hung up. I called my husband. I called my mom. My husband started asking questions that I couldn't answer because I didn't even know what he said. I just heard cancer. So then I had to call him back, and then I asked questions, and then he gave me some answers. He made me feel a little bit more comfortable, but I was still a little nervous. So at that point, he told me I needed to reach out to my gynecologist so that she can explain it to me more and get me referred out to a breast surgeon. So I did that, and I went to the breast surgeon. Another shout out, Dr. Rimmer. Woo, woo, woo. He's the best, y'all. He's awesome. So I went to Dr. Rimmer, and when I went to him, he just pretty much started explaining all my options, what he thought might be best. But of course, you know, they always tell you it's your decision, but they'll just tell you what they think is best. So he started talking to me, and we started going over this mastectomy. And if you all don't know what a mastectomy is, it's where they cut off your breast, they save your nipple, and they just do reconstruction. And when he started talking about that, I broke down. And the reason I broke down is because at that point, it really felt real. Like, it was real. This was really happening to me. I was really in here thinking about having a surgery for breast cancer. That's what kept popping in my head, breast cancer. And that's why I broke down. And he just reassured me that it would be okay. It's early. He kept saying this, it was called early. So I can cure you. You're going to be okay. And by him saying those words to me, it made me feel a whole lot better. Not 100% better, but it made me feel a little better, okay? So just make sure you have a doctor that's comforting, who understands you, who can be empathetic. Because some doctors to you, you're just like another patient. And it really sucks to have a doctor who can't empathize with you. And he is awesome because he sat there with me. I cried. He gave me tissue. He just told me that, I'll take care of you. I'll take care of you. And that made me feel so much better in that situation, you guys. I'm about to cry, but all right, I'm not going to cry. I'm not going to cry, guys. I'm not going to cry. That just really made me feel so much better. So from there, I had to make an appointment to see an oncologist. I had to go get an MRI. I have to go to a plastic surgeon. It's just appointments after appointments at this point. So from Dr. Rimmer, which was the breast surgeon, I had to go to the oncologist. The oncologist pretty much did genetic testing on me. And she told me once I get my MRI, I have to come back, and then we'll go over possible treatment options. So the MRI came back, and it was still the same. My lymph nodes were not swollen, which is awesome. The cancer had not spread, which is awesome. And the oncologist was pretty much telling me all of my treatment options. She told me that, we have to wait until after the surgery to find out exactly what type of cancer it is for the DCIS, if it's mucus or coli. I think that's what she said. Don't quote me. I think she said if it's mucus, I could do Metis pills. If it's coli, I would have to do chemo. So we still have a long way to go. It's still going to be a process, but I'm just blessed that it was caught early, and I'm able to get it taken care of. Thank God. So right now I'm at the spot where I've seen my oncologist. I have to go to the plastic surgeon still, and from here I have to go back to my breast surgeon, and from there we'll be making an appointment to have my surgery done. But I just really wanted to get on here and share this story because I want you all to know that just because the doctor tells you that nothing is wrong, and if you still feel like something is wrong, please go get a second opinion. Because had I not gotten a second opinion or came back in 6 months, and actually when I went back, I didn't even want to go to the first doctor. I wanted to go to a different one. So when I went to that second doctor and they told me that they wanted to look more into it, it made me nervous, but it also made me relieved because I knew that I was on it, and I knew that if it was something, it was something that was going to be caught early. I wasn't going to just let it keep going on and going on. So when I got that second opinion and they told me what they told me, I was in shock, but I was also blessed. I felt so blessed that I listened to myself and I went back. Because had I not, this story may have been a totally different story and with a totally different outcome. So I'm just blessed that, I caught it early. We caught it early, and we're able to take care of it. I just want to say, listen to your body. If your body is telling you that something is wrong, please look into it. Don't think because you're young that it can't happen to you. Because it can. It really can. And if something is wrong, early detection will save your life. Early detection will save your life. They told me if they had to guess, I was probably within, the stage 1A right now. And I could smile. I could smile through this process because I know that it's just a test. It's just a test, and I know that the Lord only gives his toughest battles to his strongest soldiers. And I know that I'm going to get through this. I know that it's going to be a process. I know that this journey may be a long journey. But I know that in the end, I'll be able to hold my head up high and say that I'm a breast cancer survivor. I got this. So you all be blessed. Take care of yourself. Listen to your body. Pay attention to yourself. And just be blessed. All right?